Hello friends, it is Wednesday, and you know what that means. How could you possibly know what that means unless you have access to my schedule? Well, on Wednesdays, I make my way from Toronto to Kitchener to work at Sage Naturopathic Clinic. I've been working here at Sage Naturopathic Clinic since the beginning of my career. Since moving back to the city, I decided that I was going to stay because I love working here. I love the team. I love the patient base. In my practice here at Sage, I see all kinds of different health concerns. The majority of my care is in a men's health niche, but I see digestive issues, autoimmune conditions, hormonal issues, weight loss, diabetes, hypertension, cholesterol, just another day in the life of a naturopath. And of course, when it comes to treatment modalities, we always focus on nutrition and lifestyle first. Sometimes we'll throw some supplements into the mix, but what I really love about working here at Sage is that we have a beautiful IV therapy suite. And as the years have gone on, IV therapy has become a pretty big part of my practice, simply because I find that so many people can benefit from this option. It's a great opportunity to get really high dose and really high quality nutrition straight into the bloodstream. Today, I'm going to be taking you through the process of how I build our IV bags in our sterile compounding facility, and we'll talk a heck of a lot more about why IV therapy might be a good addition to your health plan. So let's get out of this car and let's head into the office. One of the reasons I love working here at Sage is because they have one of the best supplement dispensaries in any clinic that I have ever seen. Look at this. Wall to wall. Second wall over here. Come on. Look, Mom, I'm on a wall. That's me. What? Before we start making the IV solutions for the day, we got to take a look at the schedule to see who's booked in and what formulas we got to make. So a little bit of paperwork, got to start with that. Staying organized when it comes to making IV solutions is incredibly important. Sometimes you could only have maybe 2 or 3 IVs on your schedule. Other days you might have 12, 13, 15 IVs. And usually we make all of these IVs at the beginning of the workday so that we don't have to continuously go back to the lab over and over. But when you're making multiple IVs all at the same time, it can get pretty challenging and quite easy to mess up somebody's solution if you're not paying attention. But with these, what we're able to do is we're able to take a look at the schedule, see who's coming in and what formula they have been prescribed, and then we simply fill in the blanks, stick it on the bag, and then we make them based on the recipe that we've written up on the label. Stay organized, kids. Trust me, key to success. So a lot of clinics that offer IV therapy will have preset formulas that we can simply apply to various concerns. And oftentimes that's what gets prescribed simply because it's a little bit easier to keep a track of. Now, of course, there's always going to be situations where a patient might require some form of higher level customization. That's certainly something that we can do as well. But today, the majority of our patients are just getting some of our standardized formulas. There is a very strict list of what can go in the bag and what cannot go in the bag. All of our formulas here at Sage and at most naturopathic clinics that you'll find in Ontario, the formulas are based around what we call the standard Myers cocktail. This is a combination of full spectrum B vitamins, so B1, 2, 3, 5, 6, 12. Sometimes you'll add some methylated folate in there as well. Vitamin C, you can usually go up to about 10 to 15 grams of vitamin C before specialized blood work is required. And for most people, 10 grams is a really healthy dose that you can keep them at. Only under certain situations would you have to go above that. Probably a discussion for another video. And depending on what we're trying to do, we will alter the contents of the bag or the concentrations of some of these solutions. We're going to finish these labels and head on into the lab. As I mentioned in the car, we usually have to make our IV solutions in a sterile compounding environment. Good thing we have this awesome little lab. Open the door. That we can make everything custom. Let's take a look around. Whole wall of supplies, syringes, needles, band-aids, cotton swabs, cupboards filled to the brim. Look at that. We have to keep certain nutrients refrigerated. Got to keep a couple juice boxes on hand too. You never know. And the main attraction, the fume hood. Let's turn this bad boy on. Once this fume hood turns on, it gets a little bit loud. So apologies if you hear some noise in the background, but you're coming along for the ride, which means you get to experience every part of this whole process. So here we go. Fume hood on. I wonder if this mic is picking that up. Let's grab those nutrients. Some of the nutrients are shelf stable, so they sit inside of this cupboard. Others, not shelf stable. I need to stay in the fridge. So like I mentioned, some days are super busy, some days not as busy. Just got a last minute cancellation, so we're only down to 3 IVs today. 2 of them in saline, 1 of them in sterile water. Main difference is sterile water, no salt. We're gonna throw some gloves on, clean everything, and get started. Now the whole purpose of sterile compounding is to make sure that we do this as safely as possible. And this means reducing the risk of cross-contamination in the IV bags as much as possible. We do this in a laminar flow hood. That's the fancy name for this big contraption that's blowing very loud air. And essentially it circulates the air and draws dirty air to the back, up and out, so that there's always clean air inside of the hood. I didn't show it in this video, but I've already sanitized the entire inside of this thing, and you're supposed to do that before and after you start your sterile compounding. We're slowly going to get our nutrients and our IV bags into the hood as well. Each nutrient is going to also be sanitized, as well as every bag before we get it in. Now, you didn't click on this video to watch me clean individual bottles and wipe down bags before I throw them in. So take a look at this empty hood. It's about to be filled with a whole bunch of good stuff. In 3, 2, 1. And there you have it. Let me pick you up and let me show you what we got going on. We've got every nutrient with an individual syringe and needle ready to go into our 3 labeled IV blank bag. You might be thinking that this is a pretty wasteful process, and the truth is, it kind of is. That is the ugly truth behind the curtain when it comes to most medical procedures. But at the end of the day, the most important thing is patient safety. And so we simply cannot compromise cross-contaminating nutrients from one bottle to the other, because we might get a precipitate in one of the bottles. There might be some kind of bacteria that crosses from one to the other. And so these syringes and needles are designed for single use only. Sorry, environmentalist, it kind of hurts my heart too, but at the end of the day, patient safety first. Without further ado, let's start putting some nutrients into these bags. We're going to sanitize the tops of each of these bottles, as well as the insert portion of the IV bags themselves. We're going to start with the calcium chloride. Each of these bags is getting 3 milliliters. So in this 10 milliliter syringe, I'm going to draw 9 and add 3 to each. So here we go. Got to make sure that we read at eye level and keep everything in the fume hood. That's where the clean air is. So we definitely don't want to bring it outside of the fume hood when we're doing our drawing. When we're done, we get rid of it. This takes a little while, so why don't we speed up the video? Here we go. This one's vitamin B5. Our adrenal support bags get quite a bit of this, guys. So take our time, measure it out, off we go. If this video wasn't so fast, you would see that I'm actually really taking my time. Even though I've done this hundreds, maybe thousands of times. I don't know, it's been a long time since I've been doing this. The truth is, you have to make sure that you are double, triple, quadruple checking the labels on each of these bags to make sure you're putting the right amount of solution into every bag. But there's also a certain level of caution you have to practice, making sure that you don't cross-contaminate. And for your own safety, these are open needles, so try not to stick your hand with it. That's happened once or twice to me. We're gonna try and avoid that today so that you don't see that happen on camera. This is a fun one. This is our B complex that we add into the bag. Now, B complex is a bright yellow color. It's the vitamin B2 or riboflavin that makes it this color. So this gives the bags a nice bright yellow color that has cutely nicknamed these bags, especially in the US. You might hear certain clinics refer to these bags as banana bags, which is pretty funny, but it's the B complex, specifically the vitamin B2, that gives it this yellow color. Vitamin B12 also has a really bright color. It's a bright pink. I don't know if you can see it in the camera here. Look at that. So vitamin B12, of course, also goes in the bags. This is one of those nutrients that we can also deliver intramuscularly, which means that we can do injections either into your arm. Some people even get it in their butt if they don't want to get it in their arm. In my opinion, I think it's always best, if you're gonna do IV therapy, get it all in one shot as part of the massive delivery system of nutrients you're getting through these IV bags. Next up is vitamin C. These bags get quite a bit of vitamin C, 10 grams per bag to be specific. And Finally, the amino acids. We work closely with Pace Compounding Pharmacy, not sponsored, but we do love you, Pace. And they've put together this awesome Pace Amino Blend, which contains a broad spectrum of amino acids that we are allowed to infuse here in the province of Ontario. Pace made it possible for us to be able to give our patients a good dose of amino acids. So thanks, Pace. We appreciate you. Last one. And that's it. Let's turn this loud fan off. Take a look at that. Ain't she a beauty? So these bags are built in about 250 mils of saline, and then total it's maybe about an additional 100 milliliters of nutrient solution that's added into this. By the time we hook this up and drip the whole thing into the patient's arm, it can take from 45 minutes to an hour depending on how good the veins are. But really it's a good opportunity for patients to just unplug. They really can't move all that much once they're sitting in the chair, so they get to read a book, listen to a podcast, make a phone call if they want to, and they're going to be hard pressed to find this level of quality and concentration of good quality nutrients going into their system in any given time. So it's really one of the best interventions that we can offer as naturopathic doctors for so many things, and that's why people love coming in for them. I'm going to clean up this area. I'm going to show you where you could get an IV here at Sage if you really wanted to. Personally, it's my favorite place in the whole clinic, so I'm excited to show you. Honestly, these are some of my favorite seats in the house, actually probably in the world. Oh my goodness, to be a patient in your own clinic. What a dream. As you can see, we're surrounded by beautiful plants, all maintained by our clinic owner, Dr. Deanna Walker. I don't know where she got her green thumb from, but I can barely keep basil and mint alive, so Deanna, if you're watching this, I'm gonna need your help, but that's outside of this video. Here, patients enter the lounge and they take a seat in one of our comfy lounge chairs. They'll be greeted by one of the IV certified naturopathic doctors, whether that be myself or our IV administration nurse, Laura, and they'll begin their session. Usually an IV therapy session will always start with a series of questions, just making sure that you've had something to eat, something to drink, you don't need to go to the bathroom, you're feeling comfortable. We'll also check to make sure that you haven't had any adverse effects to previous IVs that you might have had. And if it's your first time, we'll run you through kind of a series of things that can happen or shouldn't happen, mostly just to kind of clear you for consent, but also educate you as to what you can expect. If you've never had an IV before, then maybe you might find this valuable too. I'll tell you what I usually tell patients. If it's the patient's first IV, I'll always explain all of the contents of the bag, how much of each nutrient is in there, and I will let them know the amount of time that they could probably expect that they will drip for. Usually for the bags that we just built, it's about 45 to 60 minutes. We start by taking the patient's vitals, that is their blood pressure, their temperature, and their pulse, just to make sure that everything is within normal limits. We'll do this before and after to make sure that everything stays status quo throughout the session. We'll check both arms to make sure that there is a good enough vein for us to successfully do the infusion, and then once we find the good vein, off we go. Once the infusion begins, some stuff is normal, some stuff is not so normal. I usually tell patients that it's normal to feel a bit of a cool flush at the area of insertion of the catheter, a bit of a warm flush around the body. Some people report smelling or tasting the vitamins as they're being infused. I don't actually know why that is. I've tried looking it up, but if somebody knows why, drop a comment, let me know. I think it would be a cool thing that I'd be able to explain to my patients. I always let the patients know that their pee is going to be the color of the IV solution for about 24 hours after, so don't freak out when you look down. Now, it's not abnormal to feel a bit of a throb or an ache in the arm that the infusion is occurring in. I oftentimes will tell patients it's usually about a 5 out of 10 in terms of intensity. You're very rarely going to not feel anything at all, so it is kind of normal for you to feel a little bit of discomfort, but it certainly should not hurt. Oftentimes we'll throw a heat pack on the patient's arm, or we might slow down the rate of drip. It'll take a little bit longer for them to get through the session, but at least it'll be a little bit more comfortable. What is not normal is a sharp stinging or burning pain at the area of insertion. And this is usually like an 8 out of 10 to even a 10 out of 10 in terms of intensity of pain and discomfort. It's not good. Now, it's not dangerous by any means, but it certainly just does not feel good. And so that's why I'm very clear with patients that if you feel this, you let me know right away so that we can stop the drip, add some heat, and get that catheter out of your arm. This is what we refer to as an infiltration. And if we catch it in the early, it's usually really mild and it will dissipate within about an hour or so. An infiltration is when a small amount of the solution leaches its way out of the vein and goes into the surrounding areas of the vein, or the interstitium, as we call it. Now, these solutions are pretty dense and they have a high amount of vitamin C. Remember, vitamin C is ascorbic acid, and so it's acidic, and that means that it will burn if it comes into contact with parts of the tissue that are outside of the vein. A little bit of heat, some time, some hydration, oftentimes it will go away, and whatever is lost to the interstitium will oftentimes be resorbed back into the body, so we don't have to worry about losing out on that benefit. If that does happen, we will oftentimes switch to another vein and try again. Now, I always tell patients in advance, it's really important for you to come to an IV session well hydrated. The better hydrated you are, the more fluid there is in the veins. So they're nice, plump, and juicy and easy to access. If I can access the vein easily, we'll have no issues infusing a large amount in with very minimal discomfort. So help me, help you, help me, help you. Yeah, once the drip begins, we are good, and I will check on you intermittently just to make sure that you're comfortable and everything is going according to plan. I always tell patients that afterwards, you're gonna feel one of three ways. A little bit better, not much different, or maybe even a little bit worse for a period of time. Of course, we aim for a little bit better. That's always the goal. And what that looks like is usually a little bit of a bump in subtle but noticeable energy levels. We're improving general immune function by flooding the system with tons of high dose nutrients. You might even get a better night's sleep that night. So cheers to better sleep. If you don't feel all that much, that's also perfectly normal, but that's why we generally recommend these in protocols. People will oftentimes come once a week for 4 to 6 weeks to top the levels up, and then we can discuss a maintenance schedule moving forward depending on your needs. Finally, if you feel a little bit worse before you feel better, that's normal too, but it's important to understand why that can occur. The main reason is vitamin C at high doses, especially around that 10-gram mark that's in most of our formulations, can cause a bit of a hypoglycemic effect. So if you come in dehydrated, or if you come in having not had food in a long time, you can sometimes feel a little bit lightheaded, a little bit nauseous, all the symptoms that generally come along with being hypoglycemic. Nothing that a granola bar and a juice box can't bring you back to, so that's why we stock them in the fridge. We've got some granola bars hiding in the back as well. The best way for this not to happen is to avoid it altogether, and that means coming to your IVs well hydrated and having had a meal or a snack about an hour or two beforehand. Finally, I've done so many IVs at this point, I've lost track. And I'm very fortunate to say that I've never seen anybody have an allergic reaction to anything in the bag. But I do always tell patients that if they are experiencing shortness of breath, difficulty breathing, some sort of anaphylactic reaction, we would consider that to be emergent. And so while you certainly can call the clinic to let us know, we hope that you will. Before you call us, that's a 911 call. We would consider it an emergency. So make sure to present to your closest hospital as soon as possible. Finally, guys, I would be remiss if I did not say, I don't think that IV therapy is for absolutely everybody. Certainly, it can help lots of different people with lots of different things, but it's not a one-size-fits-all solution. And that's why it's super important that if you are considering IV therapy, or if you're even just a little bit curious, speak to your naturopathic doctor to see if it's a good fit for you. Whether you're here in Kitchener or out in Toronto or anywhere in Ontario, you can find an IV certified naturopathic doctor that you can discuss your specific needs with to see if IV therapy can be a part of a bigger, more holistic treatment plan for whatever your concern is. Alrighty guys, I'm taking a look at the time and I'm realizing that my patients will be here in just a couple minutes, so I gotta wrap this up. Thanks so much for watching my video today. I hope you learned something, and if you have any questions about IV therapy, drop me a comment. I read them all, I respond to all of them. Huge shout out to my family here at Sage Naturopathic Clinic in Kitchener. Make sure to like the video, subscribe to the channel if you found this valuable. Subscriptions to the channel is the best way to support, and I hope to see you in the next video. Take care.